Hello everybody and welcome to the HacettepePathology.com Case of the Month session, and today I'm going to present a renal tumor and of a 40-year-old male with a previous biopsy, and they decided to take it out. Unfortunately, the patient was metastatic, and this was a palliative surgery. But as you see, the tumor is well expansive, infiltrating the kidney, or rising from the exophytic from kidney and as an exophytic mass. And as you see, the mass has some solid areas with cream colored and some necrotic areas, and it's quite heterogeneous with solid and cystic parts. And now I'm going to show some parts of the lesions, and this is a kidney here, and here the tumors begin. We have this epithelioid, like gland forming parts of the component of the tumor, and and this was not the most common part of this tumor, and the tumor was mainly composed of these ossifications and this matrix producing component here, as you see, and we have this ossified areas within mineralization in just in the center, and the cells accompanying to this matrix is bland spindle cells, as you see here, and there's some cartilage also here. Okay, this is the osteoid part, and let me just turn back to these epithelioid areas. As you see, we have this gland-like structures with the eosinophilic material resembling somewhat osteoid. What we can, I'm not, it's not easy to call this an osteoid, but we have this hyalinized proteinaceous material, and here more this gland-like epithelium with this secretion, and I let you enjoy some more. And the cells look like monotonous, bland, glandular structures. Okay, and let me show you another part of this tumor. Here, again, as I said, the most vast majority of the tumor is composed of this cartilage and this osteoid-like material, some hemorrhage areas, and necrosis. And some other areas again here. It's quite this component of the tumor is quite resembles the medullary part of the tumor, but it has this spindle cell component as well as this epithelial component, and it shows that biphasic growth pattern. The interesting part of this spindle cell component, as we had, you see this herringbone pattern, and the the cells are a little pleomorphic, and I'm going to show you if I can find here more cells with hyperchromasia, and there were some more. Yeah, here we have this more pleomorphic with the giant cells, also more pleomorphic areas, and here some giant cells and more maybe small round cellish areas with some more epithelioid to maybe these areas just resemble telangiectatic osteosarcoma like, or aneurysmal cyst like areas. And I cannot find the best atypical cell here. Sorry to wandering around too much, but here, yeah, here it is. We have this pleomorphic cells, and actually the diagnosis was straightforward. However, we have some deviating features like this pleomorphism and that much osteosarcoma like areas, and see the pleomorphism, and this, of course, here we have this some atypical mitotic figures and so forth. So yeah, and we have ordered some bunch of stains, and let me show you this is keratin, and the keratin was positive in the, and it was strongly positive in this epithelial component, as well as some spindle cells, scattered cells, spindle cells also stained for keratin. And let me show you more other spindle cell areas with like smudgy, patchy keratin staining. And of course, in the differential diagnosis, we have this sarcomatoid carcinoma, or maybe the urothelial sarcomatoid carcinoma. The macroscopy doesn't fit too well. However, also we have done this P63, and it was also negative for P63. And I also thought about the sclerosing epithelioid fibrosarcoma, and first impression I thought those glandular structures are maybe of the entrapped renal tubules, and I ordered MAC4, and MAC4 was also negative, and GATA3 was also negative. And I also ordered the TLE1, and TLE1 was positive in epithelial component, as you see here, more pronounced than the spindle cell component. And finally, we ordered SX18 fish, break apart fish, and as you see here, we have this the break apart of the red and green signals, and the diagnosis was synovial sarcoma, and we have it both biphasic synovial sarcoma and poorly differentiated synovial sarcoma with the high-grade spindle cell and osteosarcoma-like areas. Thank you very much, and I hope you enjoyed, and see you next month. Thank you.